Last thing we're going to talk about with the endocrine system is the major kind of one that we talk about. We talked about hypothyroid and hyperthyroidism. The other major disease that we hear a lot about and is very common is diabetes mellitus. So diabetes mellitus means kind of honey, so we're talking about sugar. So diabetes mellitus is constant high glucose concentration, so continuous. That's why we check the A1C, which is looking at past glucose levels, and they're continuously high. What happens with high glucose levels, which is also known as hyperglycemia, so hyper meaning high, glycemia meaning, or glyce meaning glucose, sugar, and emia is in the blood. So, okay, breaks up there. So this is going to be continuously high levels of blood glucose. And it gets to the point when we talk about kidney reabsorption. So glucose is always going to be filtered out because it's not a blood cell or protein in the blood. So it's all filtered out, but then the kidney is going to take it back in. So it gets to the point where the kidney wants to take 100% of the blood glucose back into your bloodstream. But it gets to a point where it can't. There's just so much and it's continuously going through that it can't reabsorb. So you normally should not see any glucose in the urine. You never pee it out, you're going to keep it because that's going to be your major source of energy for your neurons. It's making you to pee, so we like glucose. We're going to keep it. So when you have glucose in the urine, it's abnormal, and we call it glycosuria. So urea means urine, and glyco is going to be sugar. You can also see it at glucosuria, same thing, glucose in the urine. The other thing, I'm not going to go into too much detail, but if you're curious, what happens is water likes to follow glucose. It's another one that kind of sodium, water follows, glucose likes to follow, or water likes to follow glucose too. So if water is actually following glucose into the urine, so it's not being reabsorbed as much too because it's following the sugar, it's following the glucose, then you're actually going to get increased urination, which is called polyuria. So you have excess urine production, meaning there's a large amount. So that means you're going to the bathroom more frequently. With that, you can also see kind of what we say polydipsia, which is going to be drinking a lot because you're losing more water, so you want to drink more. It can be caused by genetic issues or mutations. So it's not very common for this to happen, but it can, where you don't make enough insulin by the pancreas. They're weird insulin molecules, so they can't fit with the receptors because they're abnormally shaped. Or the receptors are messed up. So either the molecules in the insulin are messed up or the receptors. And that's genetic causes. Um, Type 1 diabetes mellitus is going to be kind of what you see as juvenile or childhood. So you see it in children and young adults. So it's earlier in age. It's only about 5 to 10% of actual diabetes cases are type 1. Most are going to be type 2. This is because you're not making enough insulin from the pancreas. So this is where you just don't make insulin. If you don't make insulin, well, then you can't lower your BG because insulin is lowering your blood glucose, making it go inside the cells. And if you don't have insulin to go to the receptors, to go for glucose to go into the cell a lot more, well, then the cells aren't getting the glucose that they need. So because you're not making insulin, you have to give yourself insulin. So we have insulin medication. It can either be injections. More often, it's going to be insulin pump. or device that's always looking. So continuous infusion of insulin, it can change based on eating. So you get to the point where you're kind of controlling your blood glucose through this. Type 2 is going to be the most common form. So often it's associated with weight, but not all the time. So larger, more kind of obese individuals can have a higher risk of getting diabetes mellitus. So the difference between type 1 and type 2 is you're making insulin normally. So you are working and making tons of insulin, but your tissues are not responding properly. So it's called insulin resistance. And this comes into play with the down regulation and the up regulation that we talked about. So if you are making tons of insulin because your blood sugar is high a lot, but your cells are sick of glucose because they're getting it all the time with all the insulin, that they get to a point where they are just making two receptors. So it gets to the point where they are just inundated with insulin all the time because it's made, that it gets to the point where there's not many receptors. So you're making plenty of insulin and you have plenty of sugar, saying glucose, 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 constantly around. Well, it gets to the point where your cells are just kind of sick of it. So since you're making insulin, at least in the beginning when it's early, eventually gets to the point where your pancreas even gets sick of making insulin and stops. Um, you can treat with diet, so lower glucose in your diet, or and exercising, so you burn off more of the glucose by converting it to ATP, and then medications that'll help lower glucose. So you don't need to supplement with insulin because your pancreas is making it. You just need to find ways of getting the glucose lowered and used up, um, and help with lowering that in other ways. So about 25.8 million people in the US have type 1 or type 2. In If untreated, so if you don't have insulin or you're not exercising, taking meds, doing anything, then you're going to have issues throughout your body. So without insulin, so then this could be the end stage of type 2 if it's not treated, or type 1, or functioning insulin receptors. So some way that the cells are getting that communication, cells can't take in glucose. Very, very, very little. So they need. So insulin must be used so that cells can take up the glucose. So cells are thinking, okay, I'm starving. I want my sugar. So if for whatever reason you have a bunch of glucose hanging out outside in the bloodstream, you don't have insulin, um, or you don't have the receptors, glucose is just going to hang out in the bloodstream and it can't get into the cells. Well, the cells want glucose. They need it. They need it to make ATP for their normal chemical reactions. So they run out of ATP. So they're constantly calling out saying, I'm hungry. I want glucose, but they can't get it. So they're thinking the cells are sending signals that there's not glucose, even if there is, even if there's tons of it. They're saying, okay, well, there's not sugar, even though there's not insulin. So you continue to increase your sugar, your blood glucose. You're going to break down lipids and proteins, trying to use those as energy sources and convert them to glucose, but you're also going to try to use lipids and other ways to make ATP. So you're going to break down your fat, you're going to lose weight, you're going to break down your muscle mass. You can also change blood vessel structure even if consistently not treated. You can also see what we call diabetic retinopathy. That's going to be issues with your retina. because you're changing the structure of the capillaries, so the blood vessels in the retina. There's a lot of blood vessels in the retina. You also, because of the abnormalities in the vasculature, have an increased risk of heart attack, about 3 to 5 times more likely. So you get to the point where you have blockages in your cardiac circulation, and that can cause an increased chance of heart attack. You also have diabetic nephropathy because the kidneys are kind of overwhelmed with all the glucose that they can have degenerative changes and can lead to kidney failure. Can also have diabetic neuropathy. Um, Again, issues with blood flow to neural tissue. So, a lot of times with this issue, and you have blood flow really reduced, it can have issues in the feet. So that's why they say diabetic people often have issues with their feet because their peripheral circulation is damaged. And so, less blood flow being able to get to your feet can cause no oxygen getting there. You don't have glucose that you can get in there because the tissues are dying. So it can lead to the cells dying, ulcers, infections, even loss of the feet.